There are aspects of delivering your baby that people tend to gloss over, and I would like to share some of those with you today. My name is Allegra Zemel, and I am a maternal child health RN and IBCLC, which is an internationally board certified lactation consultant. Delayed cord clamping is the practice of waiting to clamp the cord after the baby's been delivered. This can increase the blood flow to the baby and is something that you'll probably want to discuss with your provider. Once the baby's delivered, the umbilical cord is clamped in two places with stainless steel clamps. Sometimes a provider offers cutting the umbilical cord to your partner, and I'm here to tell you there's no way to really mess this up because the blood flow is already cut off on both sides and you are just cutting the middle between those two clamps. After the baby's been delivered, you need to deliver your placenta. This typically happens within 5 to 20 minutes after the baby's been delivered, and you'll probably be so distracted and enraptured with your new baby that you might not notice your provider or a nurse pressing on your stomach, possibly doing some fundal massage. They may ask you to cough or bear down, and you'll push your placenta out, which will be a walk in the park compared to what you've just done. If you've delivered your baby by cesarean section, your provider will take the placenta out for you. Once the baby and placenta have been delivered, your provider is going to assess your perineum and see what kind of tears have occurred and what kind of repairs they need to make. These are called lacerations, and typically with a first delivery, there's usually some laceration. They're graded in degrees, so you might have a first degree laceration, which shouldn't be too bad. A second degree or third degree. A fourth degree laceration is a little bit of work to take care of and heal. The nurses will show you how to care for your perineum after it's been repaired. After you've delivered the baby and been stitched up and cleaned up, this is a great time to bond with the baby, do skin to skin, and probably initiate breastfeeding. After feeding the baby, you hopefully will get to settle into a nice teenage deep slumber. And after that sleep, you'll probably need to get up and go to the bathroom for the first time. When you get out of bed for the first time to go to the bathroom, you'll need to ask for assistance, and someone will escort you to the bathroom, make sure that you're sturdy on your legs, and show you how to care for your perineum. It's very important to empty your bladder. It may be difficult to void that first time after delivery because your perineum may be stretched out or desensitized, but it's very important to try to relax and empty your bladder completely. If you have a cesarean delivery, you will probably have a catheter in place from the surgery until the following morning, and you will need to ask for assistance to get out of bed that first time after the catheter has been removed. You'll go to the bathroom and you'll void, and again, the nurse or the nurse's aide will show you how to care for yourself. The morning after delivery, you'll need to get some blood work done again. When you first came to the hospital, you probably had a blood draw and labs were drawn to get a baseline. After you've had the delivery, they're going to draw blood again to be able to compare, make sure that your body is recovering and responding well to the delivery. After delivery, you might feel like you still look pregnant. Things are stretched out and you may be retaining fluid, but over the course of time, your abdomen and all the organs inside will go down to its normal size and location. You may be feeling gassy, and it's important to pass gas in order to advance to solid foods if you've had a cesarean section. Sometimes women who have had a vaginal delivery and have some lacerations and repairs are are really nervous about having a bowel movement, I'm here to tell you that you need to just go for it, that it will only get worse if you hold it. Your provider will come see you in the hospital and you'll be cleared for discharge to go home. There are a number of comfort measures you can plan to use at home, including pain medicine, stool softeners, sitz baths, and tux pads that would be good for healing the perineum. A lot of these little tidbits about what happens after delivery may not have occurred to you, or maybe you've heard horror stories from your friends. Just remember that it's part of the process of having a baby, and it's all going to be overshadowed by the beautiful new person that you've brought into the world.